So this is part 4 of the high-risk newborn, and we're on the preterm infant. So the overall picture that I want you to have in your head when you think about the preterm infant is in a picture of immaturity. All of their body systems are immature. Let's start with this baby's brain. When you look at this baby's brain, the vascular system in their brain is extremely immature. The blood vessels are extremely thin and fragile, and it makes this baby's brain more susceptible to having significant hemorrhages and the baby having anoxic insults to the brain because of bleeding in the brain. Their immune system is immature, causing them a greater susceptibility to developing infections. It's basically given that preterm babies will have at least one episode of sepsis while they're in the NICU because of the immaturity of their immune system. When you look at the newborn baby who's term, their liver is immature and has difficulty conjugating bilirubin. Well, the preterm baby, their liver is even more immature than the term baby. So they have an even greater disability, I should say, or decreased ability to conjugate bilirubin. And it's one of the factors that puts them at greater risk for developing jaundice. When you look at the preterm baby's kidney system, their renal system is immature, and they'll have decreased ability to filter, so they have decreased glomerular filtration rates, and they're at greater risk for fluid balance issues. When you look at the integumentary system of the preterm baby, there is diminished cohesion between the dermis and the epidermis, and they have an immature basically their skin is immature, and that puts them at higher risk for impaired skin integrity. They don't have as much subcutaneous fat as an older baby, which puts them at greater risk for hypothermia. When you look at their intestinal system, their GI system, in the preterm baby, their gastric motility is decreased, and they lack enzymes that are needed for the metabolism of proteins. So even though they may be born, and even though you may be able to get certain nutrients in them, they don't have the proteins available to metabolize those specific proteins. When you look at the muscle mass of a preterm baby, their muscle mass is smaller than the term baby, and those muscles are not as strong and as developed, so that can compromise their respiratory effort. When you look at the respiratory system of the preterm infant, they have limited development of alveoli. They also lack surfactant, which is necessary to keep the alveoli open and to keep the lungs from collapsing. So they have a much greater risk of developing conditions such as respiratory distress syndrome and issues associated with apnea. And then when you look at the nervous system of the preterm baby, their nervous system is immature, and this can compromise their respiratory effort. Literally every body system is immature. I have said this to you guys in class, but it might make more sense to you now, and that is, for all of our efforts when we're trying to buy babies time in utero, a couple of days, 2 weeks, can make a big difference for a preterm baby. A baby's brain at 35 weeks in gestation only weighs 2/3 of what it will weigh at 39 to 40 weeks. So we really want to get them as close to term as possible because of the immaturity of their body systems, the immaturity of their brain. And a preterm baby, because their central nervous system, amongst other body systems, will be immature, can predispose them to some problems that they can develop. We went over the assessment of a preterm baby when I did the Ballard assessment of the gestational age assessment, so I'm not going to rehash that. I'll just highlight some things that you'll see specific to the preterm baby. But if you remember the Ballard assessment or the gestational age assessment, preterm babies will have differences in each of these areas. When you look at their skin, there'll be less subcutaneous fat, greater surface area in proportion to their weight, and the skin that they have is thin. And really early babies, their skin can appear red, almost translucent, and in some instances it can appear gelatinous. And you can see this in this picture of this preterm baby. The baby's skin is very thin, it's red, it's shiny. This baby doesn't have a lot of adipose tissue. Their skin is just very, very thin and fragile. And when you're talking about babies who are born early or born with skin issues, the risk of the baby of developing infection and other conditions when their skin is thin and fragile and their skin isn't fully developed, it can predispose them to lots of problems, and that's why babies can get infection, and sometimes that infection, if it leads to sepsis, they can go into organ failure and they may not survive. When you look at the posture of a preterm baby, I talked to you guys about this on day 1. The posture of a preterm baby will be very open. They don't have the neuromuscular strength or development to bring those extremities close to their body or to hold their extremities in space. So you'll have a very open posture, and that can actually cause them to also lose heat. We talked about the genital urinary assessment findings for a preterm baby, and I'm just reminding you of the content that we talked about earlier, as well as your female babies and your male babies. When you look at your preterm babies, depending on where they are in gestation, may determine what needs they have. These are very early, probably your 23 weekers, 24 weekers, somewhere in that ballpark. But they may need a lot of technological intervention to try to support them. So they may be on a ventilator. They may be intubated and be hooked up to different devices to help maintain their body systems. But when you're looking at babies that are born that early or even earlier, like babies that are 23 and 23 weeks, you're really on the cusp of viability. So their needs are going to be very, very specific. They're going to you're going to look at respiratory, thermoregulation, all body systems really. So they're going to have a lot of interventions that you will be putting into place for these babies. I said this earlier, but it comes back again. When you look at the environment of the NICU, babies that are preterm don't have the excessive reserves for energy for being overstimulated. So we try to group our activities, and you can see symptoms that they may be being overstimulated. They may turn away from you. They stiffen their extremities. They may make the cry face, even though their cry may not be audible because they're so early. So we try really hard to pay attention to how they're coping. We'll assess their pain, and we'll try to give them frequent rest periods so that their body has a chance to meet its own metabolic needs, because they don't have a lot of reserve left over for extra stimuli. Preterm infants have little energy for maintaining muscle tone. They're easily exhausted from the noise, from the routine activities and interventions that we do with them. And so the responses that you might see, changes in their vital signs, a drop in their pulse ox, we try to avoid having too much stimuli for them if possible. Keep in mind too, your early preterm babies, their cry is feeble and seldom heard, so they may make more of a cry face versus you hear an audible cry. There are some common problems of the preterm infant, including their respiratory, cardiac, thermoregulation, fluid electrolyte, renal, nervous system, and integumentary system. All these body systems are immature. Let's talk about some of the differences in their body system. The cardiovascular system is immature. They have an increased risk for patent ductus arteriosus, which you should remember from our adaptations lecture. Because of this, in their immaturity of their cardiovascular system, they have increased blood volume to the lungs, increased risk for pulmonary congestion. This means that they're going to have an increased work effort to breathe, so an increased respiratory effort, and they're going to need more oxygen use. The baby might also have difficulty transitioning from fetal circulation to neonatal circulation, so there can be some congenital anomalies associated if those if the bypasses, and we talked about those different bypasses, don't close. In addition to that, they have very fragile blood vessels in their brain, so it increases their risk of developing bleeding in the brain, and they have an impaired regulation of blood pressure because of their body systems being immature. Preterm babies are at increased risk for developing a problem which is called anemia of prematurity. And this has to do with a couple of things. First, when you look at the red blood cells compared to that of an older infant, even the older infant's red blood cells don't last as long as an adult. They break down more readily. While a preterm baby, the red blood cells have a much shorter lifespan than even a term baby. And they don't have as many red blood cells as an older child. In addition, the preterm baby does not get the transfusion of iron stores the last few weeks of pregnancy that a term baby does. If you remember back when we talked in adaptations, we talked about the term baby the last few weeks of a pregnancy getting some iron stores from mom, which are transferred to the baby's liver, and it's there to meet the baby's iron needs for the first 4 to 6 months after birth. But your preterm babies don't get those transfusion of iron stores. In addition, what do we do every couple of hours to check on the stability of the baby? We come and we frequently draw their blood for laboratory and diagnostic testing. So those factors can increase the baby's risk for developing anemia of prematurity. And in assessing the baby, you can see pallor, where the baby will become pale. They'll show symptoms of heart failure and can go into shock. For these factors that I just mentioned to you, preterm babies may require frequent blood transfusions. They may have to have erythropoietin given to them. You may, in addition to the symptoms I gave you, assess them for tachycardia, for feeding difficulties, activity intolerance. Those all can be symptoms of anemia of prematurity as well. But they may have to have more frequent blood transfusions, iron supplements, and erythropoietin given to them. So now we're going to go into the respiratory adaptations for your preterm baby and their needs. And they can have problems. This should really make sense to you because we talked about surfactant at great length when we talked about the term baby, but your preterm baby doesn't have adequate surfactant amount to maintain their alveoli, to keep the alveoli open, so they increase risk for their lungs collapsing and for them developing respiratory distress syndrome. And their respiratory system is immature. The respiratory system, when you look at all the body systems and the development and the maturity and fetal development, it's one of the last systems to completely mature. And preterm babies, depending on where they're born in gestation, may not have enough surfactant. In addition, they may have an unstable chest wall that can increase their risk for atelectasis, for their alveoli collapsing and their lungs collapsing. In addition, the respiratory centers in their brain are immature, so that increases the risk of having periods of apnea. And when you look at their respiratory system, their lungs, they have very, very small respiratory passages, which can be easily obstructed with respiratory secretions. And because they have an immature respiratory system, they are unable to really cough, bring up, or move those respiratory secretions. So it increases their risk of developing respiratory distress syndrome or conditions like TTN. So when you look at the lungs and the alveoli of a term baby versus preterm baby. The term baby has good blood vessel supply, good blood vessel contact with the alveoli, and the alveoli are mature. Whereas in the preterm baby, the alveoli don't have as much direct blood vessel contact. The alveoli are immature, they don't have enough surfactant, and they collapse more easily and can increase their risk for stress.